Welcome, and thank you for standing by. At this time, all participants are on a listen-only mode until the question-and-answer session of today's conference. At that time, to ask a question, please press star and the number 1 on your phone and record your name at the prompt. This call is being recorded. If you have any objections, you may disconnect at this time. I would now like to turn the call over to Karen Francis. Thank you. You may begin.
All right. Good afternoon, everyone, and welcome to the first webinar for the 2016 Rural Behavioral Webinar Series. My name is Karen Francis, and I'm a principal researcher at the American Institute for Research and the lead for the Rural Behavioral Health Initiative, along with my colleague Joyce Sabian from the Mental Health Promotion Branch at SAMHSA. This webinar series is supported by the Mental Health Promotion Branch of SAMHSA in collaboration with the American Institutes for Research and Affirma Solutions. Thank you for joining us this afternoon. We're looking forward to a lively and engaging conversation about the open table, how a faith-based support model can transform futures in rural communities. Our presenters for today's webinar are John Katoff, CEO and founder of the Open Table, John Vandenberg, consultant to the Open Table Board, Stacy Cram, presiding bishop, first presidency director of Community of Christ, my colleague Frank Ryder, from a human services financial specialist at the American Institutes for Research, and Rachel Ludwig, project coordinator of Cuyahoga County, New York, Chautauqua County, New York, Tapestry Systems of Care. Next one. So the objectives for the webinar this afternoon are as follows. We want to learn how the open table model can support positive life transformations for children, youth, and families. Understand the theory of change and evidence basis that underpin and reinforce the model. Explore how faith, communities, and formal service systems can collaborate. And we will learn about how to seek assistance to pursue potential development of the open table. At the end of the webinar, we'll invite you to ask questions of our presenters by using one of the two methods. You can either type your question into the participant Q&A box that is located on the right-hand side of your computer screen, or you can ask a question live when we open the phone lines. We will try to respond to many of the questions as time permits us today. Please also note that this webinar, both the PowerPoint and the audio, will be posted on the Rural Behavioral Health web portal in about 3 weeks from now. And at the end of the webinar, I will provide you with a link for the Rural Behavioral Health webinar web portal. And just a small reminder, we ask that you mute your phones during the presentation so as to avoid any background noise as the presentation is given. Also, please do not put your phone on hold, as we will be able to hear any background music or messages that are recorded on your phone system. So without delay, let us get started with a few polling questions. We want to learn about who are the participants joining us today for the call and where in the country you're located. So our first polling question asks, in what region of the U.S. is your community located? Northwest, Mid-Atlantic, Midwest, South, Southeast, West, Northwest or Mountain, Southwest, Alaska, Hawaii, or any of the territories. Just please take a few minutes just to let us know where you're located. All right. So we're getting in these your responses to parts of the country in which you're located, where your community is located. And we see that the majority of our participants on the call with us this afternoon are from the northeast mid-Atlantic region. Is that right? Mm-hmm. We have a number of also joining us from the Midwest, southeast, south and southeast, west, northwest, and mountain. And then we also have a number of our participants also from the southwest. So thank you for joining us. So our second polling question is that we'd like to know what role you play in your program or community. Is it a management and administration, clinician or service provider, family or youth, community-based provider, federal, state, or local policymaker, faith-based advocacy or community coalition, or some other? And we'll just give a few more minutes, minutes for you to complete that poll.
Could someone please share the website with me where I can see the presentation?
So, could you, are you at all on the, can you see anything on the, at all?
I just see the, I'm not any place online. Where should I go?
Okay,
Did you register? You registered and didn't get a link?
Yes. I've gotten all the emails about the password and when to sign on, etc., but I do not see the website.
Why don't you? You can't even
give her a phone number. Give her my phone number. I tell you what. Why don't you give us a call? 202-815-4161. Just call us on that, and then somebody will be able to help you. Okay?
Give me that number again, please.
202-815-4161.
Thank you.
Thanks. All right. So with this polling question here, I see that we have the majority of our participants are in management and administration. We also have a number of participants joining us today who represent state, federal, or local policymakers, and a number of our participants are family and youth. Welcome. Community-based providers, faith-based advocacy and community coalition representation, and some are also representing other roles within your community. So thank you so much for participating in these polls. And now we want to take a few minutes just for me to just set the stage for our wonderful presenters this afternoon here. So as many of us are familiar, right, with the many challenges that systems of care leaders face in nurturing initiatives from existing projects to transformative opportunities for individuals, that is the children, youth, and families. One need only consider the roller coaster ride of the past 8 years to understand how major economic and social forces, as well as political forces, can threaten great visions with unreliable funding and shifting winds, right? At the individual and family level, even most of our best services often close shop at 5 p.m., every day reopening doors on Monday morning and hoping that clients have managed to survive long enough for their next dosage of treatment. So that is so long as there are still more units of service authorized within the limitations of service budgets and program rules. So social workers, for example, at the Casey Family Programs, working with young adults emerging from foster care in Phoenix, have described this issue that I speak of in terms of the expiration date of professional services. While complex and often chronic human challenges persist without interruption. So even the best treatment services are typically designed to address a specific symptom or diagnosis, but very few recognize and address root causes or even actively address real barriers in people's lives that limit and impact, the treatment. So like poverty, discrimination, hopelessness, and damaged self-concept, are issues that have to be dealt with. And success in services is often rewarded with termination of services instead of customizing it, reinforcing it, and extending its support. So ironically, tremendous opportunity rests within the membership of every community in this country, whether it be rural or urban, but we're focusing on rural here this afternoon. Yet formal service systems admit one of the biggest limitations in any ability to tap into the reservoir of this informal natural support that could, effectively multiply human services budget many times over. So systems of care at their core values and principles have long recognized the primary value of harnessing individual motivation from voice and choice and cultural sensitivity and responsiveness, in approaches, but methods to bring those values to actual individual experience still remain quite limited. So how do we deal with the issue of poverty? Is through how we often deal with this issue of poverty is really through short-term fixes such as, the food banks and referring families to government agencies. Most of us are not trained to intervene in poverty. Instead, focus on safety or emotional issues. So the open table model provides a framework to provide a wraparound type of process for the delivery of services necessary to comprehensively build foundations that can promote activities to permanently get out of poverty, as focusing on children, youth, and families. So, as I set the stage here, we'd just like to move on to the third polling question, just so that our presenters can get a sense of, what do you see as some of the challenges that exist in your particular community. So with polling question 3, if you could just take a few minutes just to respond, which of the issues are the big that are on this slide are the biggest or the largest issues that you face in your community as it relates to delivery of service? Is it a lack of sufficient formal services, low incidence that require individualized approaches, a lack of a vibrant community, funding and using untapped community resources? Is there little to no collaboration between formal or informal systems? Or if there are some of the other challenges that you face in your particular community, if you'd also just take a few minutes to, give us a short writing. You can write your responses in the chat box on the right-hand side, on the left-hand side of your screen. So we'll just take a few minutes here with this polling question. All right here. So, we can definitely see a good majority of our participants, cited the lack of a vibrant community, as a vibrant economy, as some of the challenges that they face. So, talking about the issue of financing, and then finding and using untapped community resources also tends to be another challenge that are facing several of our rural communities. All right. Well, thank you so much for responding to those polling questions. And so, without further ado, it is my real great pleasure to turn the webinar over to our first presenter, John Katoff, CEO and founder of the Open Table. John.
Thank you, Karen, and thank you, Samson, everybody, for joining today. Next slide, please. One more slide. So Open Table trains diverse faith communities to translate their vocational and life experiences and personal networks into tools that people experiencing poverty can use to develop sustainability and their human potential, while relationship with them transforms congregations and their members. Congregations across the country are moving from transactional relationships with the poor to transformational relationships. It actually looks like giving out used clothes doesn't help people overcome poverty. Some of the untapped resources of the faith community, 100 congregation members have about 2,000 years of job and education experience. Those 100 members have some 5,000 connections to people in their community who regularly provide Open Table with jobs or better paying jobs, dentistry, childcare, donated cars, auto mechanics, attorneys, accountants, furnishings, tutoring, computers, financial support when needed. There are also financial resources in faith communities. Charitable giving to religious organizations in Maryland, just where SAMHSA is headquartered, is about $1.7 billion a year. So how does government connect to the support potential of the faith community, and how does the faith community connect to the knowledge and experience of government to extend the continuum of care into the community? Next slide, please. Open Table started when a homeless man asked our congregation if he could worship at our church. So we began a relationship where we could use our knowledge and contacts to enable him to escape homelessness and poverty rather than our used clothes. His life was transformed, and so were the lives of the many people from our congregation. We gained a new perspective on poverty, and we learned how to make a real difference. My congregation currently has 4 tables operating, 2 for homeless vets and 2 for homeless young adults who identify as LGBT. Congregations recruit volunteers who are trained to launch what we call tables. A table is a platform where individuals or families in poverty and congregation members form mutual relationships. Each table is a group of volunteers, 12 for a family and 6 for an individual. They make a year commitment to ask as a team of life specialists, encouragers, and advocates. Table members with the individual or family being served establish goals and develop an overall plan, and they implement it. They share social lives and activities. They become lasting friends. The person being served has full voice and choice. Table members network in their congregations in the community for resources to support the plan. As tables end after a year, they transition into an after plan through which table members and the community they serve remain in supportive community together. Next slide, please. A quote from a table member: with 10 people on a table, we collectively know almost everyone in the congregation and what resources they have. The congregation members always offer their skills for whatever contribution is needed, and we also use third parties, not in our congregations, who we know from our backgrounds. Tables also offer long-term supportive relationship. I'd like to give you just 3 two-sentence stories. A table who served a young adult who had aged out of the foster care system, who was seeking to have her child returned from the foster system. Her table members drove 8 hours to stand in front of a family court judge and provide character witnesses. There's a graduated foster who had aged out and was served by a table, who is now serving on a table for another young adult. A table graduate on probation relapsed and was incarcerated for another year. His table members were waiting for him when he walked out of prison to help him restart. Next slide, please. The Open Table is, there are tables operating in about 20 states. Some are new, and so there's a small number, and some are growing quickly. I'd say the fastest growth of Open Table is in the areas where there are faith-government partnerships. There's so much knowledge and intellectual capital to gain from government that can help congregations extend the system of care and build on the clinical work and the investment of government that's already been made. Congregations want knowledge. They want experience. They want to have good outcomes, and this partnership powers up that relationship and really draws in the whole community. You can see a list of the populations that are being served, except for homelessness, which was really the first man that we met. Every population we served is because somebody in a congregation or a congregation that had a group of people who had a heart for that population called and said, can we learn to serve that specific population? And certainly that's where government and especially SAMHSA has come in to be a mentor and a knowledge center for the faith community. So this incredible untapped resource can be invested in people through a shared purpose between us. Thank you, Karen.
Thank you so much, John. And now I'd like to turn the webinar over to John Vandenberg, the consultant for the Open Table. And John will focus on the evidence base and relevance of the wraparound concept and unique model that attributes to the fit for a rural community. So, John?
All right. Thank you, Karen. Hey, everybody. Thanks for being on the webinar call. I probably met many of you, but I really like this format of training and education. I'm one of the founders of Wraparound, so I know a lot about Wraparound. I have volunteered the last 5 years for Open Table, and recently, as of March, began doing a small amount of direct consultation to the Open Table board. But I heard about Open Table through a colleague who told me, this really seems a lot like Wraparound. And once I got to know it, I understood that there really were some remarkable similarities. Next slide, please. And specifically, I want to talk a little bit about Open Table and Wraparound and how this all fits together, particularly with rural America, since I think we have almost all rural people on the call today. I'm also rural. I live in a county in western Colorado, a county of less than 30,000 people. We have Wraparound here. One of the things that we know from studying our Wraparound families is that we have about 100 families right now in Wraparound, and of the 100 families, about 85% are also in poverty. And pre-Open Table, we often didn't address that poverty issue in Wraparound. We would talk about it. We'd be concerned about it. We might put employment on a list of things to cover, but we didn't really directly address poverty as Open Table does. So the intersection of Open Table and Wraparound is very powerful. I'm going to turn next slide, please. Just a little bit about this. I think, when we talk about systems of care, obviously most of us on the call are familiar with systems of care. It's really that formal systems coming together with our community. Wraparound is now spread to over 50 states around the world. But it really was a connection with Open Table that I think began to take Wraparound into very different areas, particularly this notion of services are always going to be, by necessity, time limited. The table, though, that is formed, that John Kadoff mentioned earlier, really has a long-term relationship going with the person on the table. And if you want to go to the next slide, please. I'm not going to go through all of these. You've got them or can see them. But we see some real similarities between the two models, Open Table and Wraparound. Clearly both individualized, just to hit some high points. Clearly consideration of the personal culture of the consumer or the family. In Open Table, we use the term brothers or sisters, or in some of the Jewish communities, the term Hallel, which is friend. And we clearly have a plan that's driven by the brother and sister in Open Table as it is the families in Wraparound. System integration is a big part of this. One of the major differences is Open Table is all volunteer-based. It really is implemented out in the communities, out in faith communities around the country and in Canada and in other places. The whole notion is that the table really extends the reach of what Wraparound and other services and other support systems can do and provides a very permanent support and linkage for those families. You could go to the next slide, please. We're really looking at Open Table in terms of research and evaluation following the path that we did with Wraparound. Back in the mid-'80s as Wraparound started, and I'm acutely aware that when you start saying back in the mid-'80s you're getting old, which I think I am, but the reality is we started way back when looking at the research and evidence base for wraparound, and that has continued to progress with some fantastic research listed on the National Wraparound Initiative website if you want to check that out. But we've begun to really look at open tables specifically. One of the things we think is that much of the wraparound research, because it's so focused on individualization and voice and choice and cultural competency, we think a lot of that research relates directly to open table. But we're also looking at new research. We recently did a study of the 2013 program graduates. The results of that study is listed on the Open Table website. But just for example, one of the things we found is that for 85% of the graduates, 1 year after graduation, after a year of open table participation, direct participation with the full table, 1 year after graduation, 85% of the graduates were still in frequent contact with some or more of their table members. We're doing some other things. If you know wraparound, you know the Wraparound Fidelity Index. We are working with the National Wraparound Initiative, April Sather and Eric Bruns in particular, to really adapt the WIFI to open table. We think that's a really important thing to do. We're also looking at impact of table involvement on volunteers and participating congregations. John Kadoff mentioned earlier how it's really a transformative experience to be part of a table, not only for the brothers and sisters in Hillel, but it's also a formative experience for the volunteers and the congregations. And we're looking at that in the next year or two. Next slide, please. The next area of research that we're really interested in is, for lack of a scientific term, is called the ripple effect. And probably most of you on the call understand family systems theory, how one person in interaction with another person and a family member creates relationships. And two people, I have a relationship with you, you have a relationship with me. As that broadens out across many people in our family and our friends and our contacts, those relationships grow and multiply to very large numbers. We really think this is true with Open Table. We think that a single graduated brother, sister, or Hillel has a very positive effect on the lives of many, many people other than just themselves. We think this is really true in rural areas, and where everybody knows everybody's business, people in need are often more visible in the community than in large cities. So this notion of transformation, as one person graduates Open Table, it moves their way permanently out of poverty over time and into the ability to really form relationships with people on their table and others. We think this is about transformation. It brings hope into a community, to a family and community. So we're very excited about this. I think right now with Open Table, we have a lot to learn. We've learned a lot. We're in a very exciting period of very rapid development of innovation. So I thank you very much. I'll turn it back over to Karen.
So, John, thank you so much for sharing that information with you. And before we move on to Stacy, I'd like to just take a few minutes. Want to open up the phone line to see if we have any presenters who have any questions for us at this point in time. Questions for any of the panelists. So we'll go ahead and open the lines, and feel free to ask your questions.
To ask a question, please press star and the number 1 from your phone. Unmute your phone and record your name at the prompt. Again, that is star and the number 1 to ask a question, and we'll take a moment for questions to come through. Please stand by. I'm showing no questions at this time.
Okay, there's one question that we have here in the room.
Okay, so this is Joyce CBN. Hi, everybody. I'm with SAMHSA, and I just wanted to ask the panelists about how you identify participants in the open table. Is it the same for every community? Do you do it in different ways? How does that process happen?
Thank you, Joyce. This is John Katov, and it's been different for every community, at least in the beginning of Open Table. We did not, we weren't exploring and developing this new view of the faith-government relationship with SAMHSA. And so congregations were involved with a lot of community-based organizations, best practice organizations in homelessness or foster care, serving the working poor. As we began to connect to SAMHSA and systems of care, that was really the discovery for us of the significant and important intellectual and social capital that is available through collaborating with government. I would say there isn't, a faith community that I have met and talked about our relationship with SAMHSA that isn't interested in sharing a purpose with a government agency that can help provide that experience and intellectual capital, and for the faith community to really feel that they're co-investing where community dollars are already being spent. So I think that the real long-term future is in the faith government partnership. I think we're just scratching the surface on the possibilities.
Yeah, that's exciting. And I'll toss out one more. I'm just wondering if you talk a little bit more also about your focus on families and individuals and how that works. Particularly, I'm interested in the family piece because I think that that's so needed, and a lot of times services are focused on one individual or another in the family, and so having that family focus, I think, has so much potential benefit, and I think we're learning about that in many areas.
I think that's a significant question, and what we have found is that a lot of times in the families that we serve, so many services are focused on the adults and fewer services on the children in a way that can really impact their development. Healthy relationships, support for their needs at school. Tables are able to view the family as a whole, not as segmented parts like services may, and really following that model of wraparound, that the whole family itself, if the family moves forward together along their important goals, that whole family unit is going to become a support for each other. And that's really the support that can help them sink roots along with the community around them. And I have to say, too, that in congregations, congregations as communities mirror the family. And there are children, there are high school kids, there are young adults, there are families, there are grandparents. And so it can really be a powerful generational approach, approaching the family as a whole rather than kind of pieces, than fragments. And being able to see how wholeness and the support for wholeness could really transform them. We are serving a number of families in system of care, and I see full tables helping a mom with, networking in the congregation for jobs, and I also see a whole table going with the family to a science center. So that community, that village, I think really has an indelible impact on that family coming into the community in a healthy way.
Well, great. Thank you so much, John, for responding to those questions. And I think at this time we can move on to our next presenter, Stacey Cram from the Community of Christ. And Stacey, we'll focus on the open table model in a rural congregation that she's associated with. So, Stacy, go ahead.
Thank you so much, Karen. Good afternoon, everyone. It's my pleasure to be able to join with you in this way, and I want to add my voice to thank you for participating in this experience. I'm assuming that you have joined because of your passion and desire to help others, especially in the rural area. I want to just share briefly with you this afternoon how we have been working and partnering with Open Table as a model to use in bringing together diverse faith communities across interfaith boundaries and also connecting with government agencies in the rural areas, primarily of the central part of the United States. Part of understanding what we have been doing is understanding the context that we find ourselves in. And in rural America these days, the role of various churches is changing from years gone by. And the nature of how leadership is provided within churches and congregations and mosques and all the different kinds of faith gatherings has taken on different models. A lot of that is to do with the fact that a lot of our rural congregations are smaller than they were in decades past, and the ability to support full-time ministers in those rural areas, the dollars and resources have been stretched really thin. The Presbyterian Church in the U.S. Produced a document recently that talked about 17 different pastoral options for small churches. One of them was the traditional model of a single full-time pastor, but one of the other options was really to look for lay ministers that could really step up and take the responsibility for leading the church. There's another study that reports that 1/3 of all rural Lutheran churches have fewer now than 50 members. And in Community of Christ, we would estimate that about half of our congregations are found or located in rural parts of the United States, and none of our rural congregations have paid leadership, so they're very dependent on volunteers and lay ministry. And so that creates a very interesting challenge for us in how do we live out the tenets of our various faith movements, most of which have some version of the golden rule, which is about helping others and doing unto others as you would want to have done to you. And we have found that Open Table is a way to help link together groups of people. So a small congregation or who feels like that they might not have the capacity or the resources to make a difference in their town in changing the cycle of poverty for people, they can reach out and partner with other faith movements and other faith communities, and together they can work with the local government agencies and create a process for a person that literally helps transform that person's life, but also it transforms the perception and the understanding and the sense of value of those faith members who thought that they could not make a difference. So Open Table has become a really important element for us. When we think about rural America, there's a lot of stigmas that go along with that. There is a sense that everyone's in everyone else's business. One example that one of our congregants said to me one time, he said, "If I sneeze at my breakfast table, my neighbor down the street is the one that yells out, 'God bless you.'" So rural America just is everybody knows what's going on, or at least thinks they know what's going on. And as a result of that, a lot of times, a lot of the needs that exist or issues that bubble up for families don't necessarily make it into the public awareness. And a lot of times there's a hesitancy for people to reach out and ask for help because they're afraid that they will somehow be judged by their neighbors. In addition to that, where there is cycle of poverty, where families have been in poverty for more than one generation, oftentimes there are stereotypes and assumptions made about the family that stop people from really seeing the people behind the circumstances and seeing the possibility of what could potentially happen if people had the benefit of networks and connections and friendships. And so what we're discovering is that faith networks, by their very nature and calling, are designed to see the worth of all people, are designed to bring out the blessings of community, and are designed to reach out to the other person and provide help without judgment. At least that's what most faith communities are about at their very core and calling. And so Open Table then becomes a really great model to help create a support system and network for an individual or a family in a way that helps them move to a different state in their life. So it becomes not a constructive way of helping a family or an individual move out of poverty, and it avoids some of the issues of toxic charity, which often are the modes that our faith communities have used to try to be helpful, when really often they become part of the problem. So as you see on the slide, human services provided, especially through government agencies, are often in scarce supply. They're often designed to be more short-term. Oftentimes, people are having to travel from the county seat or from other areas where services are being provided to where people are actually in need of those services. And one of the things that Open Table has helped us do is to bridge across those limitations. Oftentimes, we have discovered that the workers in various government agencies or other social service providers have a very high ratio of the social worker working with just a huge number of clients. And so their ability to be present and available when that person needs them is sometimes very, stretched very thin. So Open Table provides a viable framework that allows people to partner together and to create a support system and network. As John talked about, they become a source of knowledge, support, and ideas that can help a family or an individual consider the options that are available to them, and they can guide them in making different decisions about their life and their limited resources. The table can also provide their network of relationships and friends and connections and can help break down barriers that oftentimes keep people from getting the services that they need. Oftentimes, when a person walks in and doesn't have someone else with them to help them navigate the system, they just aren't aware enough of the system to know how to ask for the kind of services that they need. And often as a result, they go without even the limited services that are available in their area. So one of the ways that we have found that the faith community has been able to help government agencies is by providing that landing point for people who are really in a stage where they are ready to make changes but simply need help and networks of people to guide them. And faith communities using the Open Table model become a landing point for those people to come to. And what government agencies and social services have been able to provide to us as we use the Open Table model, and what we're hoping to develop further is creating a referral service. Because sometimes people of faith, as they think about wanting to be actively engaged in abolishing poverty, they don't know how to get started, and they don't even know where to go or how to make contact with a person or a family that is potentially in need of help. And so oftentimes the human services in rural areas become the best source of referrals to make suggestions of who faith communities might invite as their brother or sister to their open table model. So as we continue to explore the relationship between faith communities and the government, we think that there's a great partnership that can occur there as we each take the resources and the gifts that we have to offer in abolishing poverty and pool them together for the greater good. So, Karen, thank you. I'll pass back to you now.
Okay, thank you so much, Stacy. Thank you. And so now I'd like to turn the webinar over to my colleague at AIR, Frank Ryder. And so, Frank, take it away.
Thank you, Karen. Good afternoon, everyone. My role today is primarily as a bit of a historian and a contextualizer. And so in thinking back about the roots of public-private partnerships that have become prominent, I go back about maybe 20 years to the first President Bush, and we probably can vaguely remember his 1,000 points of light and the subsequent administration of Bill Clinton, where the seeking a middle ground between the notion that government can and should try to do everything to defeat poverty, as was a prominent notion in the 1960s, and sort of a reaction to that in the 1980s during the Reagan and Bush administrations about the important role of community and individual voluntarism. And it seems to me that during Bill Clinton's administration, we started to deliberately forge a middle path to bring together the strengths of both the private sector, the community, and the public sector to create something more effective. So anyway, I guess I wanted to also share a little bit about history of the application of the open table itself, primarily within one particular initiative of SAMHSA. And so that's going to be the focus of my contribution today. So on this slide, you see a report, actually sort of a manual, that was produced by SAMHSA, and it was published 3 years ago, but it actually captures learning from an initial convening that SAMHSA initiated in 2010. And at that time, SAMHSA recognized that no single organization or person can address the multitude of services needed to help people affected by mental health or substance use conditions. And SAMHSA recognized that government is not an exception to that. While the government can provide financial support and technical assistance to communities to deal with such challenges, it also recognized that the best sources are the people who live and serve and work in the community, and that the best results are often achieved when they undertake action in partnership, the communities working hand in hand with the government. So SAMHSA indicated a growing national recognition that partnerships, including faith-based organizations, are beneficial, and they actually offer a unique perspective about how to respond compassionately and effectively to the human condition. So in 2010, SAMHSA invited community leaders to an interfaith partnership summit. And folks from about 15 different communities from all over the nation came together with SAMHSA planners and tried to figure out for a couple of days together, what does it actually take in order to develop viable, productive partnerships? This document, and we gave you the link on the slide so that you can refer to it as a resource after the fact, really covered 6 critical areas first making a case for sustainable partnerships between secular and faith-based organizations. And then it actually walked people through the planning phase, how to establish a way to organize partnerships between faith communities and public entities. It offered guidance about both membership and leadership of those kinds of initiatives. And then it finally included a section about how to leverage community resources on behalf of clients also served by public programs. I want to really recognize a couple of people at SAMHSA in particular. Within the federal government, the Department of Health and Human Services has been a leader in actively initiating and supporting productive partnerships among governments and community-based organizations, and particularly communities of faith. But within the Department of Health and Human Services, I think SAMHSA has by far compiled the most impressive track record of accomplishment in recent years. So I want to recognize Joyce Sebian, who's on the phone with us today. I want to recognize Ann Matthews-Jonas from SAMHSA, who actually leads SAMHSA's Department of Community and Faith-Based Initiatives. And I also want to recognize Dr. Gary Blau, the Director of the Child, Adolescent, and Family Branch from the Centers for Mental Health Services at SAMHSA. Those three individuals have provided a great deal of inspiration and leadership in helping to grow partnerships between community organizations and faith communities and public systems, but also in recent years, very specifically in support of the growth of the open table model as a viable anti-poverty framework that is indeed transferable to all kinds of communities, including rural communities in the U.S. So this slide shows us three partners: faith communities and their volunteer members, government systems of care, and in the middle, the Open Table organization as a hub of training and support to grow this model. So just like our team here on this webinar represents several different disciplines and we're each making contributions to the presentation today, so too, these partners that are shown on the slide here each have unique contributions to offer to growing the Open Table process as a viable anti-poverty model in rural communities. Let's think about the faith communities, for example. And I really appreciated the comments that Stacy provided from her experience about this model. Faith communities do tend to be where many people in need or in crisis turn to for help and support first. Faith communities provide engaged members who are willing, able, and motivated to help their fellow travelers. Faith communities have provided human services and social justice in this country for over 140 years. They have tremendous reach. They have tremendous reach into very diverse cultural communities. And they obviously have the trust and confidence of people who seek their help. Those are only some of the capacities that are relevant that faith communities bring to this equation. Let's think about that other partner, government and systems of care. Governments can provide vision and leadership and can make strategic resource investment to help to promote good models of care and support. Governments are supported by the rule of law. They bring the power of public policy, including, importantly, the power of purse strings. They can tax us, and then they can allocate and appropriate resources. Governments tend to be listened to when there is a convening to take place. So just like the convening of the summit that I told you about with SAMHSA in 2010, governments have the ability to convene and organize people at the community level, the state level, and nationally. Governments also bring an imperative to evaluate those public investments. How are our tax funds being invested? Are they actually producing results? And so when John Vandenberg was talking to us about ways to evaluate the open table process and to measure outcomes, and we can actually measure inputs versus outcomes and see a very positive return on investment by growing the open table model. A lot of that happens with the positive influence of government to hold us all accountable. And governments can also make available technical support, and that's where the Open Table organization comes in. The Open Table organization is lean and mean. You will see a link on an upcoming slide so that you'll be able to find your way to the organization and its website. The Open Table is able to help communities to learn how to successfully form productive partnerships between faith communities and government. Just as an example, one of the early applications of the Open Table in systems of care has occurred in Orange County, Florida, Orlando. And one of the kickoff events was convened by the mayor of Orlando about 3 years ago, and she had literally hundreds of people showed up for breakfast with John Katov to learn about the Open Table model. Dozens of churches were represented in that room that day. Such is the power of combining churches, governments, and John Katov and the Open Table organization. Open Table has developed a set of tools, training materials, and very personal on-site support protocols to help to grow partnerships that yield Open Table operating to support and transform brothers and sisters in escaping from poverty and transforming their lives to something much more positive and hopeful. Okay, so here you see a white paper that was recently published by the Open Table organization on authentic partnership of faith and government and individuals in need. And as I promised, there's the URL, the web address, so that you can explore the Open Table's website. Now, this white paper describes the Open Table model, as John Katov began to do at the beginning of today's webinar. It also defines roles of government and faith communities, showing how their partnership can succeed around the Open Table model, even though sometimes other previous government and faith community efforts might not have resulted in significant and enduring change. The white paper also considers the role of government and faith community funding, the cost and the value that ensues from these essential partnerships, and it does so in particular by providing the history of the Open Table, the theory of change that underpins it, that Dr. Vandenberg began to share. You know, so much of the underpinning is in common with the wraparound model that has become so widely accepted and embraced in human services in the past 20, 25 years. The paper also provides the 5 core non-negotiable elements of Open Table without which outcomes would be unlikely to be achieved, and also provides findings from study of the Open Table model that have demonstrated impressive outcomes. It gives you a theoretical basis for the model, it talks about specific organizational aspects, and it definitely elaborates on the economic benefits of the model. So I wanted to let you know that this resource exists so that you can do some further exploration in the future. So now I've talked about a little bit of the recent history of forming productive partnerships between governments and faith communities, and we wanted to ask you in the audience to share a little bit of your own experience. In what ways have you reached out to faith communities in rural America in order to try to do some, mutually beneficial work together? So you can see some choices, and we ask you now to go ahead and to let us know, what have you tried? Okay, I'm not seeing any votes registering. Karen, can you help me out here?
Frank, we're just trying to work to see if we can open the poll really quickly. We just experiencing just minor technical difficulties here, but we should, yeah.
All right, I'll take my lead from you.
Okay. Okay, Frank, the poll's open.
Okay, very good. So go ahead, folks, and think about these different methods of outreach and just indicate which you may have tried to reach out to faith communities in your rural area. Okay, Karen, I'm sorry, I need to get a little bit of feedback.
Okay, here. So from the poll, Frank, we see that, in what ways have you reached out to the rural communities? A good majority of our participants have said through recruitment training to train outreach workers, and number have also pointed out outreach from systems representatives to faith community representatives, and then also local engagement in events.
Okay, fantastic, good, thank you. So now I want to reflect back on some of the comments from John Katov and from Stacy earlier, and to talk about the Open Table providing a very specific model that can be the focus of such partnership. Sometimes in the past, people have had the notion in general that wouldn't it make sense for churches and public systems or service systems to work together. They haven't really had a viable model, but now we do. And so I would like to just talk for a couple of minutes about how SAMHSA has provided some opportunities to actually test this model. So back in 2012 in Orlando, it happens, I was pleased to have had the opportunity to be at this big national meeting that SAMHSA convened. I told you that governments do a good job of convening. I believe that there were over 1,800 people from around the nation who care about children's mental health, who all showed up for a better part of a week in Orlando to learn together. And one of the most persuasive, compelling learning opportunities at that Training Institute's meeting was, in fact, the presentation of the Open Table model by John Katov. And I know that this had a big influence on a lot of people, including John Vandenberg and Gary Blau and myself. And so within the next couple of years, we all tried to brainstorm together how we might be able to take the magic of the Open Table model and to see whether there could be a positive application to address the mental health needs of children and youth who have serious mental health problems. And so back at the end of 2014, SAMHSA and the Open Table organization worked with my agency, American Institutes for Research, to conceptualize a pilot to test the application of the Open Table model within the context of community initiatives to support children and youth with serious mental health challenges in their families. And you can see here that 3 very diverse communities were selected for the initial pilot. And soon you'll hear from one of those sites. The initial pilot did, in fact, demonstrate the viability of the Open Table model as an enhancement of systems of care in ways that Dr. Vandenberg has already described today. For its part, SAMHSA made a series of investments which have continued to help spread the reach of this model. SAMHSA's investments in Open Table have included multiple webinars, providing Open Table System of Care pilot funding, developing information resources and publicizing and disseminating those, providing direct support for curriculum development to train both members of tables and congregation leaders, and also representatives of public service systems, both how to work together in productive partnership and specifically how to support the growth of the Open Table model in communities. SAMHSA investments have also been more generally in terms of growing training and technical assistance resources, and is providing support for evaluation of the model as well. I think most importantly, SAMHSA support has been reflected in active, engaged inspiration, encouragement, and cheerleading by people like Joyce and Dr. Matthews-Yanis and Dr. Blau. So, in addition, the initial pilots have in fact produced some valuable learning about how to install and implement this model in partnership with public systems of care, and they have actually produced some good positive results as well. So that a year later, in late 2015, we were able to develop a second similar opportunity to bring the Open Table to 3 more locations. So here you see the 6 system of care communities around the country that have so far been directly involved in growing the Open Table model as an enhancement to their existing systems of care on behalf of children and youth with significant mental health needs and their families. And at this point, it is my pleasure to introduce a representative from Chautauqua County, New York, Tapestry System of Care to share her experience, Rachel Ludwig. Rachel?
Thank you, Frank. And I really want to thank everybody for really nicely setting me up to be an example of a community involved with Open Table. Actually, through the last polling question, too, you've given me a place to really fit this example in. So I'm going to talk with you a little bit about the Open Table in Chautauqua County, New York, our system of care. Chautauqua County is a rural community in southwestern New York on the Pennsylvania and Ohio borders. We have 27 towns, 15 villages, and 19 school districts. Chautauqua County is consistently ranked one of New York State's poorest communities, and according to our United Way's 2014 survey, our population is approximately 135,000 people, with a poverty rate of over 19%, and 39% live in low-income households. I think one of the most startling pieces to think about for children in our community is that over 57% of Chautauqua County children qualify for free and reduced lunch. And probably similar to what some of you experience in other rural communities, we are designated as a health professional shortage area and a medically underserved population. So in order to try to combat some of that, our County Department of Mental Hygiene applied for and was awarded a system of care cooperative agreement through SAMHSA in 2008. One of the major areas of cultural competence that came up for us in applying for the cooperative agreement was the culture of poverty. It's really an underserved and misserved culture in our community, and that was one of the areas we wanted to look at initially and still to this date. Next slide, please. So going with the visual here of the ripple effect, we feel it's a wave of transformation. And so I wanted to share this in a couple different ways. The one piece is thinking of the road of life, going down the road of life, and you look at the rearview mirror for lessons. You look at the lessons around you and you look at the people around you. I feel like Chautauqua County does offer a nice example of faith in government and partnership. I formally represent the government side, but as you'll hear through my short story, others as well. And that's a hat that has been kind of strange to wear through this process, and I hope that you'll understand that along with me. There was a faith-based initiative formalized about 11 years ago with our Department of Social Services and religious groups, and the main concept is really to offer caring, compassion, and a hand up, not a handout. And the initiative is called the FBI, the Faith-Based Initiative, which is a bridge between government and faith communities. So this is a group that's, just as sort of Frank was talking through that one voice, one community, I thought, wow, we did some of that. We made a case for the partnerships. We organized. There's still a lot of lessons learned, and as partners shift, we do learn those lessons with new partners all along the way. But the interdenominational group has really been responsive to community needs. But one thing that was missing was a specific model. There were several of the churches, several of the pastors really looking for a model. And we would look at gaps and look at ways to fill those gaps, but still a model was needed for individual approaches and caring. And the open table was a model really that fit for what wraparound can look like in the faith community. And it's so exciting to hear the different presentations previous to this, just to hear how this is looking. Formally, it's rolling out, and there's proof behind it. It's beautiful. The open table model really trains congregations to support brothers and sisters and to develop relationships and plans. And I think that we've seen this throughout the years as I think Dr. John Vandenberg mentioned how he met John Katov, and we met John Katov through Dr. Vandenberg. So this is sort of a full circle wave for us right now. That's the constructive partnerships. So next slide, please. Just a quick example of history. So we are not a provider. We're a weaver of services. We feel as a system of care, our role is to bring technical assistance to the community and support the service system. We're looking at care coordination, and we're looking at high-fidelity wraparound. And the system of care and open table relationship was really strengthened, as Frank was mentioning, when SAMHSA really chose to support and initiate this model for systems of care. And John Katov came to Chautauqua in 2011 and came again in 2015. And 2015, this is the high-power energy that you heard about with Frank's examples. But there were more than 20 visits to different congregations that John made himself. And some congregations really piggybacked on each other, and others wanted their own team to hear the messages. We did also have an exploration with our county executive kind of kicking that off, and that was really exciting too. I think the most important pieces for me are that relationships change our lives. I totally believe in that, and I've seen it really happen. I think that there was a question about referrals being made, and we are very supportive from the system of care making referrals to Open Table, and for Open Table making referrals to the system of care. I like this quote that when I is replaced by we, even illness becomes wellness. And here's where I'm part of a we. I'm on a table myself, and I don't feel I should ask others to make a commitment that I haven't made myself, so that was important to me. And as a project director, it's been interesting to see how that plays out. One last message is just that for me, the open table is about being a real person, being a whole person, becoming a whole person. It's about long-term relationships and developing meaningful connections. So as Stacy said, it's help without judgment. So hopefully that's a helpful example for you to have, and turn it back over to Karen.
Well, thank you so much, Stacy. Rachel, for sharing that information with us, and for the wonderful work that you're doing in Chautauqua with the Open Table model. So we have quite a number of minutes left, and we wanted to open up the call for some questions for our panelists. So again, we have two methods in which you can do this. You can either, once we open the lines, ask the questions directly, or you can also type your questions into the Q&A box that on your screen, and we'll be able to respond to them. So, operator, can we open the lines, please?
Yes. To ask a question from the phone, please press
yes.
*1. Again, that's *1 from the phone.
Thank you. Okay, so I see that we have a question from one of our participants online, and they're asking, tell us about the training and supervision the tables receive. So, John Katov, I'm going to point that question to you.
Sure. Well, I think it's two parts, and John Vandenberg, I was going to ask you if you would speak about the online training as you led that development, and then I will speak more about the support and ongoing training.
Okay.
Sure. We are really doing some very ambitious things with online training. First of all, working with SAMHSA and with the American Institute of Research, we did develop last year a group of modules, 4 tables, that are being widely used around the country right now. And these are for tables that are up and running and licensed and really need that kind of support. More recently, also with some support from SAMHSA and others, we developed a series of modules, video modules, on specific issues within OpenTable. We're continuing to develop those. Next week, for example, we're filming a module on aging out kids, kids that have had really coming out of foster care, trauma, and kids that have been sexually trafficked. Our next step really is we are going to a platform called Google Classroom, which allows us to do a much more thorough job of automating our training. And our goal is to have an extremely comprehensive method of training at many different levels, from a system of care level and a government level, but also right down to the tables and the people, the volunteers managing OpenTable. I think the important thing to remember about training is that OpenTable is not implemented by a group of people who manage this out of Phoenix, all right? OpenTable has a very small infrastructure. The work is done out in congregations. It's out in faith communities. And we are a training organization, and we support faith communities who are actually doing this work. And we're hoping to do a better and better job of that, but are very encouraged by our initial training. Back to you, John.
Thank you, John. SAMHSA's funding, as well as time contributions from John Vandenberg and others at AIR, helped to develop the initial training. It's 3 weeks of 2-hour modules with resource books, an electronic parking lot for questions, and then in addition to that, a live session. Tables actually use a project management system in the cloud where the table members communicate with each other. We're out in the open and they know that, but we monitor those posts in case a question comes up or something that might need additional training. SAMHSA made an investment in additional training that we're developing this year, and I think there are 2 important tracks. One track is actually developing training modules that are hosted and starred in by our graduates, and they will be teaching, they'll be training new candidates who come onto tables what the experience is like and what to expect. And they'll also be training table members from their perspective about what it's like to be served on a table to help tables understand them as they come onto a table. The other track is we're just starting developing training for our government partners. The first is a white paper being developed on candidate selection and referral, and giving insights into for government partners about who they may think of recommending. And just lastly, on the launch side, we're manualized, have a project management system that helps congregations launch. We have a national network of people we call navigators who walk congregations through their launch process. Every congregation has a mission leader who we train to actually coordinate the launch of tables in their congregation. And they ultimately build a leadership team that helps expand it there, which is very effective. And those mission leaders in every area meet together And so in Saginaw, at the System of Care, the mission leaders meet monthly, and the System of Care provides additional training to them as train the trainer, and they can go back and communicate that. The Systems of Care have also developed in Saginaw a series of written short trainings on key topics, cultural competency, for example. And soon those will be pushed out to our tables through project management system in the cloud. So we will continue to provide ongoing training to our tables. We have a lot of experts that can consult with our tables. Dr. Vandenberg, Stan Marzowski, the former head of children's mental health for the state of Pennsylvania. We have leaders with 10 years of experience on tables, 10 or 12 years. We have access to many resources to support tables. But in the future, there is no more powerful resource than the training, the transfer of knowledge and experience from government to help congregations view and learn to serve and enhance their outcomes.
Thank you, John. So, John, I think you kind of answered another one of the questions that we have here, is that wanting some examples of how tables address the cultural and linguistic needs of children, youth, and families.
Yes.
So I know you talked about the training module that's available.
Yes, cultural competency will be next on our list, and we'll be turning to SAMHSA for that assistance. Through SAMHSA and the TA network, we've been able to connect with the University of South Florida, and they are translating our materials into Spanish so that we'll be able to invite the Latino church in the language of the Latino church. I think that's a huge step. And then after that, we will start to address this key issue of cultural competency. I would say that many communities are planning now to have shared tables with different ethnicities and races, different churches that whose members are primarily of one ethnicity, one race, are going to share tables. And so I think this is also an important step for members of the community to learn cultural competency by sharing a purpose and developing solutions for somebody in poverty. So we're really encouraged by that.
So we have a question here for Stacy. So Stacy, you spoke about engagement and partnership with human service agencies, right, and the faith community to identify, the children, youth, and family who could be served by these tables. So can you share any special secrets that you have about how you accomplished that partnership and the sustainability of that partnership?
That's a great question, Karen. At this point, we don't necessarily have any secret other than persistence and, a willingness to stay in conversation with people. Part of it has been dependent, as John said earlier, about what kind of focus a particular table wants to have. So what we have discovered is that in various areas, once we establish a partnership, then we have good sustainability because the process is so effective and everyone that's involved in the process sees the value and the transformative nature of the process. So, for instance, with our congregations in Michigan, we've been really successful with working with the foster care system. And so that has been a really helpful connection place. One of the struggles that we have when we have a congregation or a group of faith a community that wants to work in a new rural area is oftentimes that's one of our struggles is how do we find the right social service and how do we establish who we are and why what we are doing is not tied specifically to a particular faith movement or to proselytizing, so that we can create that partnership. And so that's been one of the benefits that John and Open Table and our association with Samson and others have started to help us establish that credibility of what the Open Table is about. But at this point, that usually is the longest lead item for us once we have a group that says, hey, we want to do a table. And so we start the training with the members of the table, and then we have to work really diligently in the local area to find a good referral system. So that's part that we're still learning, and that's the part that we're wanting to mechanize better. So we're hoping that conversations such as today will help us with that.
Oh, excellent. Thank you. So I'd like to, is there anyone on the phone line that would like to ask a question?
No questions from the phone.
Alrighty. So I just want to take one last question here that we have online, and it is, are human service providers very leery about working with religious groups? How do you reassure them of that?
Well, it would be interesting to have Rachel and Stacy answer that also. But I guess what I would say is that our process is one of building relationship between faith and government before we even launch a table. And I think the critical part is coming together, realizing that without shared purpose, neither of them can achieve their objectives in the community, and spending time together in an intensive way to understand each other, start to grow into a trusting relationship, and based on that, have a demonstration project that can really show to both of them the long-term potential. I will say also that around the country there are government people who are serving on tables, and there are faith community leaders who are meeting with top leaders of system of care, learning how to support each other. So I think that would show a real bridge building that can really break down the silos.
Thank you. Rachel, would you like to add anything to that?
I think just to piggyback on what was said, just the building relationship piece is really important. The persistence that Stacy mentioned is also super important. It's important to be realistic about what you can offer and what you cannot offer, and really look for those gaps that you can fill together.
Great. Well, thank you so much. And I see that we're at 4:30, so I just want to say, thank you all for joining us for this webinar this afternoon. I want to say thank you so much to our excellent panelists for that wonderful presentation and sharing information with us about the Open Table model. I just want to remind you that today was the first webinar, the 2016 Rural Behavioral Webinar Series, and we have the second webinar scheduled for July 27th from 3 p.m. to 4:30 p.m. Eastern. This webinar is entitled Developing Partnerships Between Juvenile Justice and Schools to Provide Mental Health Services in Rural Communities. So we ask you to please mark your calendars to join us for the upcoming webinars. Please look forward to additional information about registration and the objectives for each of these webinars coming your way soon. You can also visit the Rural Behavioral Health web portal for additional information and to register for our upcoming webinars. And that the webinar portal